201. Which is the predominant factor in the formation of the alveolar process? Answer: A. Eruption of teeth. 202. The decidous canine emerges? Answer: C. After first molar. 203. Which four mandibular teeth are so aligned that when viewed from the occlusal, a straight line may be drawn bisecting the contact areas? Answer: A. 5, 6, 7, 8. 204. In maxillary first permanent molar, the two obtuse angles are? Answer: C. Distofacial and mesiolingual. 205. Mesial slope of buccal cusp is longer than distal slope in? Answer: B. Maxillary first premolar. 206. Lateral movement of condyle is caused by? Answer: B. Both lateral and medial pterygoid muscle. 207. In the majority of situations, the first decidous tooth to erupt is the? Answer: A. Mandibular central incisor. 208. Pulp chambers and roots canals in decidous teeth? Answer: D. Shallow and wide. 209. The eruption age of maxillary permanent lateral incisor is? Answer: A. 8 to 9 years. 210. According to Scour and Massler, the crown completion of both permanent maxillary and mandibular first molars is? Answer: B. 2 1/2–3 years. 211. The key to occlusion is? Answer: A. Maxillary permanent first molar. 212. The largest embrasure in posterior teeth is the? Answer: C. Lingual. 213. Single central pit is formed on occlusal surface of? Answer: B. Mandibular second premolar. 214. Which teeth show less curvature on the crown above the cervical line than any other teeth? Answer: C. Mandibular anteriors. 215. Which of these teeth are highly sturdy and usually the last ones to be lost? Answer: C. Canines. 216. The tooth that is commonly seen in an abnormal relation and contact with its adjacent teeth of the same arch is? Answer: D. Maxillary lateral incisor. 217. Retrusion of mandible is achieved by? Answer: B. Temporalis. 218. Root completion of the mandibular first molar takes place by the age? Answer: C. 9 to 10 years. 219. Which of the following is dental formula of a 9-year-old child? Answer: A. 6EDC 21/6EDC 21. 220. Tooth with most variable occlusal anatomy? Answer: A. Maxillary third molar. 221. The highest, longest, and sharpest cusp on the decidous mandibular first molar is? Answer: A. mesiolingual. 222. Which of the following features of a permanent maxillary lateral incisor aids in distinguishing it from a mandibular lateral incisor? Answer: B. More pronounced lingual fossa. 223. The pulp of first primary molar contains? Answer: A. 4 pulp horn and 3 root canal. 224. In normal occlusion, with which groove/surface of the permanent mandibular first molar does the mesio-buccal cusp of the permanent maxillary first molar occlude? Answer: C. Mesio-buccal surface. 225. A distinguishing characteristic of a maxillary first premolar that identifies it as right or left is the answer. B. Mesial inclination of the lingual cusp. 226. Steepest cusp is seen in answer. A. Maxillary first premolar. 227. Upper 4 resembles 5 from which aspect? Answer. A. Buccally. 228. Maxillary primary cuspid enamel completion takes place at answer. D. 9 months after birth. 229. The shortest root on a maxillary first molar is answer. B. Disto-buccal. 230. The curvature of the cervical line of most teeth will be approximately answer. B. 1 mm less distally than mesially. 231. Oblique ridge in maxillary first molar joins which of the following cusps? Answer. C. ML and DB. 232. Following eruption, the root of the maxillary central incisor completes development at what approximate age? Answer. D. 10 years. 233. First evidence of initiation of primary dentition is usually around? Answer. A. 4 months in utero. 234. How many pulpal horns are there in the mandibular second primary molar? Answer. D. 5. 235. Which line angle area is most acute when a permanent maxillary second molar is viewed occlusally? Answer. A. Mesiofacial. 236. Mesial contact area of the permanent canine is at the answer. C. Junction of the middle and cervical thirds. 237. The primary center of formation of each lobe is present in answer. B. Tip of the cusp. 238. The lingual cusp of lower first premolar is compared to the development of answer. D. Cingulum of canine. 239. Normal dentition in centric occlusion, opposing contact may be expected at answer. B. Buccal slopes of lingual cusps of maxillary posterior teeth. 240. Which anterior teeth have both mesial and distal contact areas of at the incisal third? Answer. C. Both A and B. 241. How many roots does a primary maxillary first molar have? Answer. C. 3. 242. Which of the following gives the best description of erupted permanent teeth typically seen in a 9-year-old? Answer. D. 1,2,6 in all quadrants. 243. Cervical cross-section of maxillary first premolar is answer. B. Kidney shape. 244. Which of the following teeth have more than one occlusal form? Answer. C. Maxillary first molar. 245. Largest tooth in the mandibular arch is answer. C. Permanent first molar. 246. Buccal surface of posterior teeth are wider than lingual surface Mesial distally except in answer. A. Maxillary first molar. 247. The mesial surface of the crown is almost parallel to long axis and the root of A answer. D. Mandibular canine.